actually answer your questions. And it's Kimberley McKeown. She's a policy analyst with the ministry. She is going to explain the whole program, the pilot program itself, how it's working, etc. Ms. McKeown.
So thank you very much, Aya, and thank you, Dr. Talbot, for your presentation. I'm not sure I'll be able to answer all questions, but I certainly will do my best. So just wanted to follow up a little bit on some of what Dr. Talbot shared, as well as what was provided to you in writing from your school leaders. So you're aware that the Ministry of Health has advised that schools should be moving towards at-home antigen testing as an alternative to saliva screening. That at-home antigen testing still is screening testing and is still part of the Department of Education and schools' layered approach to mitigate the risks of COVID-19. In addition to some of the benefits to at-home antigen testing that Dr. Talbot provided, noting that she also talked about sort of the comparison between the two, one important, I guess, benefit to at-home antigen testing is that it is not disruptive to teaching and learning schedules. Currently, the in-school saliva screening program does require considerable human resources as well as staff and school leadership support in order to run, whereas at-home antigen testing, because it's being done it's sort of in the convenience of your own home, it's something that parents are taking that responsibility on to ensure that your middle school and high school children are actually taking those tests. It also requires fewer resources, and so part of the interest is also trying to take a more sustainable approach to screening testing. We are still, so we're in a position where screening testing is going to occur, it's ongoing, but we don't know how long we will be sort of in this position, but certainly for this foreseeable future, we will be still conducting screening testing, and at-home antigen testing is something that can be provided much easier than ongoing saliva screening, as was mentioned by Dr. Talbot. So we have had a lot of questions, understandably, about why we are doing a pilot program, with some parents also saying, well, private schools have been running antigen testing for some time. So first of all, well, there are a few different reasons. One reason for running the pilot is due to the sheer number of schools and program sites that are within the Bermuda public school system. We have a lot of diversity in terms of different schools, school levels, parent perspectives, abilities, and so on and so forth. And so there's a lot of also differing opinion. We have a lot of feedback from school leaders and from parents that indicates that there is support for antigen testing, but there still is a lot of preference for saliva screening. And so that's the information that we have. So the part of the reason why for doing the pilot is the plan was to collect data such as participation rates and feedback. So for example, because obviously saliva screening is something that's done in school versus at-home testing, that there are a lot of differences between the saliva screening program at school versus at home. So what we wanted to do was to collect information, get feedback, to be able to tailor and make adjustments, as well as to develop and sort of create support for at-home antigen testing as we and to also transition to at-home antigen testing rather than sort of doing it all at one time for all schools. You are aware of the backlog in terms of PCR testing. And so due to those challenges, we do expect that at-home antigen testing will be rolled out to all public schools at a much faster rate. However, we still will be continuing with the pilot because we do want to be able to collect that data and the feedback that you have as parents, and to still use that information to help improve the ongoing antigen screening program. So just to talk a little bit about the program description, and this information was in the correspondence. We want all staff and students to participate. The pilot will start on Sunday and run for 4 weeks. The tests are being offered free due to a generous donation to all staff and students. Schools do need to record who receives tests for tracking purposes. So if a school gives out 100 tests, then we're expecting 100 results to be reported every Sunday and Wednesday evening. And so accepting the tests means agreeing to participate in the program. Requirements for participants, for students to take the test twice per week, once on Sunday evening and once on Wednesday evening. Each test result must be logged using an electronic link. If a date, test and time is missed, then that test must be taken and then logged the following evening. These requirements are directly from the Ministry of Health. If a student does test positive in that unfortunate situation, they must isolate and take a follow-up PCR test. If that follow-up test is negative, the student can return to school. Unfortunately, if that follow-up PCR test is positive, the parent does need to notify the school, which is current practice now. And then persons with a positive PCR test must also follow the instructions of the Department of Health. We are very concerned, or we are very interested in making sure that we are protecting your personal information. It will be treated sensitively and protected. The information collected about the screening testing will be managed by a very small unit within the Department of Education. And part of the reason for doing it this way is that COVID-19, certainly as you're aware, has put a lot of additional requirements on schools and school leaders. So managing the data centrally is one less thing that the school principal or leadership team has to be responsible for. We do need some personal information because we do need to know who has reported and who has not reported, but we are not looking at specific who got what sort of test results. The other reason why we do want personal information is because, in terms of your names, who's participating, is because we do want to be able to reach out to you to follow up in the event that results are not submitted, as well as to collect data such as feedback, focus groups, and so on and so forth. Some of the examples of the data and information that will be collected in the pilot, you want to know, for example, who is reporting and who is not reporting, so that we can do sort of some follow-up, or if people are not reporting, we would like to know why, so that we can, for example, perhaps make some adjustments and again, do some follow-up. We would like to know the number and the percentage of persons who are reporting, and of course, the numbers of positive, negatives, and invalid results. We'll also be doing a survey midway through the pilot, as well as at the end of the pilot. And that data will be analyzed and reported to the pilot schools. Your school leaders will get data for their schools, excluding individual results. And we will also be checking in with your school leaders as well for ongoing feedback. Now, that data that I referred to, those are examples, and that data, as well as others, will be used to identify support for rolling out at-home antigen testing across the Bermuda public school system. As well, will help us to sort of make adjustments to the program, as needed. I did mention the introduction of a COVID-19 unit, and so this is the email address, covid19unit@moed.bm. I will also post that in the chat, and then you will be getting some follow-up reminder information, and so we will put that information in that correspondence to you. So I'll turn it back to you, Aya.